So people need to realize that colon cancer is the second most common cause of cancer death in the United States, and it's largely a preventable disease. By doing colonoscopy at the age of 50 for most patients when they have no symptoms, we can really prevent colon cancer by removing precancerous polyps. In order to do a colonoscopy, patients have to prep the day prior to the procedure. The prep is often considered the worst part of the procedure experience. Patients have to consume a saltwater-like substance that cleanses their colon. And this way, the next day when the gastroenterologist does the procedure, they can actually visualize the lining of the colon well. The idea is to find small little growths on the lining of the colon called polyps. And if we find them, we remove them, and this way they don't become a cancer later on in life. And that's how we prevent colon cancer. The prep is often difficult to consume. It's sometimes not so palatable for patients. Sometimes people say that it's hard to get down. But the quality of the prep is very important. If you're going to go through the experience, you want to make sure that it's a high-quality exam, and therefore it's very important to follow the instructions correctly. The day of the procedure, it's important that you have someone drive you there and drive you home. You will check in. When you check in, we give you an IV to make sure that you're completely sedated. We give you medicine through the IV. Once you're sedated, the gastroenterologist passes a small flexible instrument through the colon. The instrument has a camera at the tip of it. It allows us to see the lining of the colon well. About a third of patients have polyps, which are little growths. If you have those, we remove them, and this way they don't become a problem later on in life. During the exam, people are completely sedated and feel nothing. After the exam, we remove the instrument. Patients may feel a little bloated and groggy, but in general, they feel pretty good. And then the driver that you brought with you will take you home. It's important to remember that colon cancer is the second most common cause of cancer death in the United States. Colonoscopy can prevent colon cancer. Ultimately, this is a 30-minute procedure that can save patients' lives.